evening. Welcome to the 227th day of the Swasthya 365 Days project. Today we are going to see about the treatment and prevention of bladder cancer. Many people with bladder cancer need surgery, but in some cases it can remove all of the disease. So you'll all need other treatments along with or instead of an operation. These could include chemotherapy, radiation as well as immunotherapy. First coming to surgery. Transurethral resection of bladder tumor, often abbreviated as TURBT, also known as transurethral resection or TUR, is the most common surgery for bladder cases that is done in the early stages. It's a procedure used to take samples of tissue from inside your bladder to find out if you have a cancer or if a tumor has spread or take out the tumor. Many people go home on the same day as the surgery. But if the tumor was very large, you may need to stay overnight in the hospital. You see a blood in your pee for up to 3 days after your surgery. Drink lots of fluid with help to flush your bladder. Aim for 8 to 10 glasses per day. This can help to get an infection away. Don't lift anything heavy for 2 to 3 weeks after your surgery. Short walks are okay, but do not do any intense exercises for 4 to 6 weeks. Talk with your doctor about when you can drive and go back to work. Cystectomy. As a type of surgery, the doctor removes a part of a bladder, a partial cystectomy offered or a radical cystectomy. It is a cancer aspect to the muscle layer of the bladder and is still small. The doctor may be able to perform a partial cystectomy. But most people who have the cancer has grown into the muscle of the bladder will need extensive surgery instead. If the cancer is large or has spread to one part of the bladder, your doctor will likely to remove the entire organ and the nearby lymph nodes. This is called as radical cystectomy. If your cancer has spread further, the surgeon also remove the nearby reproductive organs and the structures. In women, this can be uterus, cervix, part of vagina, ovaries and the fallopian tubes. In men, it's usually the prostate gland and also includes the seminal vesicles and the vas deferens. You may have to stay in the hospital for up to a week afterward. Usually you can go back to the normal routine works in few weeks. Intravesical therapy. This treatment is also used for early stage cancers. Your doctor uses a catheter to inject a liquid medication right into your bladder. This will choose between two types of medication, immunotherapy or chemotherapy, often referred to as chemo. Immunotherapy is a method your body's own immune cells attacks bladder cells, cancer cells. Your doctor will inject a germ called as Bacillus Chemotherapy (BCG) into your bladder through a catheter. The germ is related to one of the causes type tuberculosis. This draws your body's immune cells to your bladder, thereby activates the BCG and fight the cancer cells. Intravesical therapy, that's called as chemotherapy. If a doctor decides to do a chemotherapy, then they will inject cancer-fighting medications into your bladder through a catheter, and the chemo works to kill the harmful cells. Coming to chemotherapy, your doctor may give you a chemo in a pill through an IV. That means that medication travels through your bloodstream and other parts of the body. It can kill the cancer cells that may have spread beyond your bladder. You get chemotherapy in cycles given between times to recover. Each cycle usually lasts for a few weeks and total treatment may be taken several months. If you are having a surgery, you will be most likely to get chemotherapy before the procedure. It can help to shrink the tumors and makes it easy to remove and makes the surgery faster. This can also make it less likely the cancer will come back. Doctors often use a chemo drug to treat the most common type of the bladder cancer called as urothelial carcinoma. Cisplatin works by damaging the DNA of the cancer cells so they can't reproduce. If your kidneys don't work well, you may give a different set of chemo drugs such as carboplatin or either Plaxitil, gemcitabine or Doxetil. Your doctor can order chemo after surgery to kill any cancer cells that remain in your body which are too small or scattered for your surgeon to remove them. It lowers the chance that your cancer will return. Radiation therapy. The treatment involves using high energy radiations to kill cancer cells. It's like getting an X-ray, only much stronger. It doesn't hurt. You need radiation for 5 days for several weeks. Your doctor will recommend for the following reasons. You have early stage bladder cancer, you have early stage cancer but have surgery. As a follow-up of TURBT, a partial bladder removal surgery to treat symptoms for advanced bladder cancer. Treatments of after or instead of surgery. Sometimes doctor will use a mix of chemotherapy, radiation therapy to avoid surgery to remove your bladder. It can be a good option if you are not healthy enough for surgery. In this case, you will be likely to take a chemo drug called cisplatin by itself or cisplatin fluorouracil or meteomycin and fluorouracil. You may also get chemotherapy and radiation together after surgery. If your cancer has grown into the muscle layer of the bladder but hasn't spread elsewhere. If a cancer cell spreads after chemo, you can try chemotherapy drugs or other types of medicine like immunotherapy. Immunotherapy. The treatment uses for immune system to attack cancer. It helps your immune system to recognize the cancer cells and dangers or launches a stronger response against them that can shrink tumors or stop fighting them from growing. Several immunotherapy drugs to use to treat bladder cancer that has spread. These drugs are called checkpoint inhibitors. To keep your immune system from attacking normal cells, your body uses protein called as checkpoints. They help the immune system tell if the other cells are normal part of the body and should be left alone or invaders that should be attacked. These drugs are given every 2 to 3 months by infusion, which makes a tube an IV that goes into your vein. One benefit of immunotherapy is the body's natural defenses. Once your immune system better recognizes a cancer, it can continue to target those cells even if your treatment has been ended. How can you prevent bladder cancer? Or can you prevent bladder cancer? There are 3 simple lifestyle changes that may cut your risk for bladder cancer. If you smoke, stop it. Doctors believe tobacco products can cause about half of the bladder cancer's cases. Drink lots of fluids. When you pass urine, you get rid of harmful chemicals that build up in your bladder. So drink up, especially water. It may lower the risk of your cancer. Eat more fruits and vegetables. Studies show that eating lots of fruits and green leafy vegetables lowers the risk of many types of cancer. It may help to cut the risk of bladder cancer too. Your risk of bladder cancer can also be increased by certain workplaces, chemicals, arsenic, aniline, and certain diabetic medications and herbal supplements. Follow all workplace safety rules and ask your doctor and any specific risks or factors you may have. Coming on to the outlook. The 5-year survival rate of bladder cancer is about 77%. That means that 7 out of 10 people who are diagnosed with the disease will be still alive 5 years later. But that's just an estimate. Your outcome is based on a unique situation. That includes that your age, overall health, how early the cancer was found, and how well it responds for treatment. Thank you.